Hello, everyone, and welcome to First Amendment First Vote's inaugural Hot Topic for Teens Forum. Thank you for joining us today. I'm Melina Carnicelli, founder and board president of First Amendment First Vote, the pathway program to government leadership for teens who identify as girls. You're about to meet members of First Amendment First Vote's Student Voices team, who are the public-facing team of this year's cohort of 153 students from New York State. Our 8-member Student Voices team conceived of, scripted, and produced today's Hot Topic for Teens forum called the Empower Cycle, focused on adolescent health around period poverty and reproductive concerns. Today's conversation expert is adolescent health physician, Dr. Karen Thielen of Upstate Medical University in Syracuse, New York. But before we begin the conversation with her, I want to give a shout out to Kate Froyo of Upstate Medical University, who facilitated Dr. Thielen's appearance with us today. Thank you, Kate. Now, please meet my friend and colleague, our Student Voices team facilitator, Julie Hempson, who is a program assistant for First Amendment First Vote. Julie is a middle school social studies teacher with the Baldwinsville Central School District in Central New York. Julie, take it away.
Thank you, Melina. It's an honor to be a part of this organization and work with these phenomenal young women. The reason that period poverty was chosen as our inaugural hot topic for this forum is that the issue has consistently proven to be the most popular topic in our local seminars. High school females across the state have consistently and overwhelmingly chosen to research, address, and resolve problems related to period poverty in their local school districts. The frequency that we see this topic is telling about the hardships that exist for young women across our state in regards to period poverty. With that said, let me quickly introduce our founding members of the Student Voices team who will be on camera today. We have Bryn Butler, a senior at Skaneateles High School, going to major in philosophy, political science, economics, sociology at Trinity College in Dublin. We have Talesi Suresh, a senior at Williamsville East, majoring in environment and sustainability at Cornell University. Krithi Pala, who is a junior at Shaker High School, and Shakti Jagannath, a junior at Shaker High School. Not on camera today, but founding members of the Student Voices team also include Juliana Schneider, who is a senior at Williamsville South High School, Talia Christopher, a senior at Amherst Central High School, who will be a chemistry major and minor in gender and sexuality studies, and Rima Khan, a junior at Williamsville North High School. It is now my pleasure to turn it over to Shakti, who will continue to start the questions.
Thank you for the introduction, Julie. Period poverty and the lack of access to menstrual hygiene products in education poses a significant challenge to marginalized communities, including women, girls, transgender men, and non-binary people. This issue intersects with broader societal challenges such as gender inequality, health disparities, and socioeconomic inequalities. Recognizing the urgency and complexity of addressing period poverty, this public forum serves as a platform for raising awareness. I'd like to welcome Dr. Karen Thielen. She's a medical specialist, advocate, and educator focusing on patient care for all aspects of adolescent health. In terms of sexual and reproductive health, she brought universal Nexplanon training to the Upstate General Pediatrics Clinic trainees, implementing LARCs, long-acting reversible contraceptives, and brought free menstrual products to such, which serves 20,000 local youth yearly. As a distinguished pediatrician, adolescent medicine specialist, and advocate for reproductive health rights, Dr. Thielen sheds light on the physical and mental health consequences of inadequate menstrual hygiene practices, highlighting the barriers individuals face in accessing essential healthcare services related to menstruation. Her insights underscore the need to prioritize menstrual health as a fundamental aspect of reproductive and overall well-being, emphasizing the importance of comprehensive strategies to tackle period poverty effectively. Through collaboration among policymakers, healthcare professionals, activists, and the public, concerted efforts can ensure that no one is left behind due to the lack of access to menstrual hygiene resources. Welcome, Dr. Thielen. We're so glad you're here with us today. I'm going to pass it over to Bryn with our first question for today's forum.
Thank you again for joining us, Dr. Thielen. To get us started, I want to address period poverty more broadly. So what is period poverty? How does it affect individuals who menstruate, and what demographics experience it the most, to your knowledge?
Okay, well, first of all, thank you so much for inviting me and for that very, very kind, excellent introduction and for your interest in this topic. And congratulations to all of you for doing this and taking this kind of leadership right now at this busy point in your lives. And, you know, to all of your colleagues also who aren't here as well. It's really an honor to be here talking to you guys about this stuff. And it is an important topic. And I actually didn't know a lot about it. I wasn't taught about it in medical school at all, or even in my residency or fellowship. We used to think that period poverty was something that occurred in other countries, like in third world countries where girls wouldn't have any access to menstrual products, and we would worry about them losing educational attainment, staying home for a week, a month, every month. And it was something we thought that didn't happen here. And I was surprised to learn that it does happen here. And it's all around us. And there are many, many families where this is a hardship. Some of them, it's because the person, it's a person with the uterus we're talking about, but I'll say girls, but anyone with the uterus can have periods, obviously. They may have very heavy periods that need medical attention that last maybe 2 weeks or longer. And that can get very, very expensive. Not to mention, of course, the other medical concerns like anemia, which I can talk about in a moment, but or they may have very, very painful periods where they cannot go to school because of that suffering, and that's an educational problem too. So in this country, it does occur. Menstrual products can cost, they're very expensive, you know, $10 to $20 a month at least. They're getting more expensive. These are sort of published numbers, and I actually think they're higher now with the recent inflation. And even when we talk about other options like a menstrual cup or period underwear, those may be less expensive in the long run, but require a significant upfront cost that a lot of people just can't afford. So there are girls in our country, and we certainly think of juvenile justice and you know, homeless youth, but it's not, it's everywhere. It's even on college campuses. There are girls who can't afford menstrual products and end up having to stay home or use kind of rags and tissues and try to have that sort of hygiene. And so a lot of people think that this should be considered like toilet paper. You know, it's freely available. It's something needed for hygiene. It's needed by about half the population, and it should be out there and available and free.
Thank you so much for the reflection. Still speaking broadly, how can period poverty impact like overall reproductive health and like well-being?
I know it's such a great question. It's such a great thing to consider. First of all, there are so many ways to think through this. So there's social, emotional, sexual health, other medical health issues, all of these categories to consider. So in terms of sort of social, psychological, educational, it's completely unfair that some girls miss that opportunity, you know, that they have to miss out on their education, staying home a week every month, which really does add up. 10 months a year, say 5 days, 5 times 10 is 50 days, and that's like the minimum. 50 days in a school year is pretty significant. So you have loss of educational attainment, which can truly affect someone's future and their options moving forward. There's also shame, a certain amount of shame with poverty, even though this is a normal bodily function. But there's a lot of shame and difficulty talking about it, and embarrassment, and certainly embarrassment if you have overflow bleeding onto your clothes, or if you're ruining your clothes or your bed. And then, you know, medically, I think it's some of the girls who have heavier periods that is treatable. We can pretty easily treat that. There are medications to help, or with the severely like painful periods that can go along with it, or very irregular periods. All of that is treatable if they can talk to someone who can help them, usually their pediatrician or an adolescent medicine specialist or an OBGYN office or Planned Parenthood. All of these places can help with these issues. And severe heavy menstrual bleeding is pretty common in adolescents and can lead to anemia. And once you're anemic, you can have trouble learning, trouble concentrating. You feel very tired. You can feel dizzy. And that affects your future also. And anemia is very treatable with diet and vitamins, but we also will never be able to treat it unless we also control the periods if they're really losing that much blood. Blood's important. Red blood cells are important. They only live 90 days. And then if you're losing so much, it's really hard to keep up. So those are some of the effects.
Thank you. And we've discussed the effects, but what are potential health risks associated with inadequate access to menstrual hygiene products?
I mean, we don't want people sort of having to use things that aren't clean, or having to stay home, and missing out on all of their opportunities of their life. Certainly if they're using something that isn't clean, or they're having to reuse things that we hear, like people are using rags and things like that, then you put yourself at risk for urinary tract infection, or for, possibly for yeast infections and other types of vaginitis.
I know you mentioned that like most of these things are treatable. Do you see this problem worsening in years? Like activity at hospitals, more people are coming in, less people are coming in?
Yeah, I don't know that I would know that, and I haven't seen studies recently, although they may be there. But I think that we've had high inflation in past years, and menstrual products certainly aren't excluded from that. So I believe it probably is worsening, and it is a challenge for families. Our clinic, actually, it was as simple as we just had to order them because we're hospital based, or we're affiliated with the hospital. We order our supplies, and it was just a matter of the clinic manager checking a box and ordering menstrual supplies to give out to the patients. And that was all we had to do to get samples. We've also been very lucky to have donated funds that we use partially to get menstrual products. We have some more control over the choice of products, because sometimes adolescents don't always none of us love some of the products that are very, very bulky that we get from the hospital. But it was just something that hadn't been considered or had been forgotten or missed, that wasn't available. And now we do have it available, and we have a sign up take free. They're in the bathroom and people can take them as needed. And they do, there is a lot of uptake of that. We do have to refill that frequently. We have condoms as well, and those go away also, which they're supposed to be taken. So we like to offer both of those as a little public health initiative.
All right. So how can we, as community members, students, physicians, how can we all raise awareness about period poverty and its impact on reproductive health?
I think it's great what you're doing right now, that you're doing it. And, I think if you're in a doctor's office and they're not giving it out, if there's a nice way to kind of ask or bring it up, so that people just may not have thought of it. I believe Scotland has made menstrual products free to everyone as of 2020. And I think we should advocate. And I think there have been movements, in this country, and we should all find those and get ourselves involved with them. The American Academy of Pediatrics has a huge push for advocacy in state legislatures and federally. And just, I think, speaking together with one voice, and they'll have different items each year that they'll advocate for, but this is one of them that we want to try to get on the agenda.
Kind of on that same train, do you think there's anything else healthcare providers could play in like addressing period poverty just in general?
Yes, I mean, I think that all of us can make sure that our offices are offering products. so that a lot of us are able to, we're fortunate that we can often have funding through donations. It is something people will donate to. We're lucky at our hospital. We have a wonderful foundation, the Upstate Foundation, that's outstanding at what they do and raising money and finding people locally who want to help. And this can make such a difference to girls. It's a small thing. It's not, when you talk about people who are donating, it's not like you need millions of dollars to address this problem on a local level. And so we can really make a huge difference. Also working with the companies, sometimes the menstrual cup companies or the period underwear, those companies will donate products and we can give them away in the office. And then kind of addressing the stigma. I mean, there's stigma about periods to begin with. It can be hard for people to talk about. And we want to make sure that all pediatricians are obtaining a menstrual history, asking their adolescent patients about when did your period start, and what kind of challenges might you be experiencing? How many days is it lasting? Are you having significant pain or heavy bleeding? Is it coming regularly? Do you miss school? Do you miss school when you have your period? And if you are missing school, why? Because there are a significant number of girls who miss school with their period. And it becomes this something that's really not fair to young women. And it is something that it seems like it could be addressed relatively easily.
Besides your offices and upstate hospitals offerings of menstrual products, do you know of any resources that are available for individuals who cannot afford menstrual products, especially in the central New York area?
I actually don't. This is where I should have reviewed these questions beforehand. I wonder if we could look into it or if one of us could look into it. I bet there's something, but I'm not, because I'm fortunate enough not to have to worry about it because we do give them out in our office. But I bet there are, I hope there are opportunities, and those would need to be publicized. It's interesting to move to, this menstrual cup and the period underwear. There's not a lot of uptake among adolescents. I think the upfront cost seems to be high and people are nervous about it. Parents don't use those, so they're not telling their daughters about it. There's some environmental concerns. Pads are something like 80% plastic and take years and years to break down in landfills. And so both the menstrual cups and the period underwear are thought to probably be better for the environment. And the long-term cost is thought to be less because they really do last. So these are things that could overall reduce cost.
Thank you. That's all right. Dr. Thielen, on a different route, our program has students from Buffalo to Albany in several different communities, and this topic has been, of course, the hot topic, which is why it's our first. So how can schools and workplaces help alleviate period poverty and create more supportive environment?
Schools should definitely give these out in the girls' bathroom. All high schools should give out menstrual products. Those should be available. It's not fair to girls. Life is hard enough when you're carrying around all your books and your homework and if you have sports and etc. But to also have to pack in your bag all sorts of products and keep them there all the time. And especially for adolescents, periods may not be as regular early. At a young gynecologic age, you might not know exactly when your period's coming. Adolescents may have a cycle as short as 21 days or as long as 42 days. And if your cycle isn't exactly a month, it's not going to be coming on the same day every month. So you may not know when it's coming. And plus, the adolescents have a lot on their mind and they can have a lot of stress. So this doesn't have to be one more stressor. So a school's bathroom should definitely give these out, and school nurses' offices, of course, should also have them, but that's not always easy. People can't always go to the school nurse office between classes.
So now that we're coming at the end of our seminar, Dr. Thielen, do you have any closing remarks? Like if there was one thing that you wanted our audience to be left with, what would that be?
I think I'd say don't forget that this is an issue. It's a silent issue. It's a hidden issue, but it's an important issue and a meaningful issue. And it seems like something that we can address if we work together. And there are solutions out there. But I think it's something people don't even realize or really don't think about. And it affects girls and adolescent girls disproportionately.
All right. Thank you so much for joining us today for this discussion. We've been so privileged to hear from Dr. Karen Thielen, whose expertise has shed light on this issue, especially on its impact on young adults' well-being and health. We've explored the role of healthcare providers, schools, and workplaces in tackling this challenge. I want to extend a sincere thank you to you, Dr. Thielen, for your invaluable contributions. Thank you so much for being here today. Let's continue to raise awareness and take action to ensure that access to menstrual hygiene products is a basic right for all. Thank you for being a part of this conversation, and let's keep pushing for positive change.